News for expecting mothers, as a new study finds the mortality rate of pregnant women is much lower than we thought. According to the study in the American Journal of Obstetrics and Genecology, the maternal death rate has remained flat since 2002, and the rate is 10.4 deaths per 100,000 births. Now that's compared to the CDC's report of 32.9 deaths. Dr. K.S. Joseph, a professor in the Department of Obstetrics and Gynecology in the University of British Columbia and co-author of this study, joins us this morning to discuss. Good morning, doctor.
Good morning.
Well, first, the study says the huge inflation in numbers is due to data classification errors stemming from the way that pregnancy was noted on death certificates. So can you explain that?
So maternal mortality as calculated from death certificates tends to be underestimated typically. And in 2003, the National Center for Health Statistics introduced a pregnancy checkbox on the death certificate to better ascertain maternal deaths. Unfortunately, this has led to an overestimation because of errors with the pregnancy checkbox being ticked even when the women are not pregnant. Although the National Center for Health Statistics has tried to correct those errors, the rates have continued to rise, and we continue to see misclassified deaths which are not maternal deaths.
Another big finding was while the number of deaths was misrepresented, the racial disparities in maternal mortality still very much persist.
Yes, unfortunately, that is the case. Black women have much higher rates of maternal death, and that is something that needs to be addressed.
Now, researchers say that Black mothers are still 3 times more likely to die than white patients in childbirth. Now, as we approach Black Maternal Health Week, what more needs to be done to address this issue?
The causes of death, the specific causes of death that are responsible for this disparity, including hypertension, preeclampsia, and other cardiovascular diseases, they have to be targeted preconceptionally and during pregnancy, and also in the postpartum period for at-risk Black mothers. And those targeted programs should help reduce this disparity.
Data from maternal mortality review committees in 36 U.S. states revealed that 84% were preventable. What are some things that women can do to lower their risk for complications during childbirth?
Well, healthy lifestyle preconceptionally is important. Diet and exercise, avoiding tobacco and alcohol and drugs. That would be preconceptionally. And during pregnancy, especially at-risk mothers should have good quality care antenatally during pregnancy and also in the postpartum period.
Doctor, thank you very much for all this important information. We really appreciate it.
You're welcome.
All right, thank you.